This is Shaitu Malampati, Associate Professor for Orthopedic Surgery and Sports Medicine at the University of Kentucky. This presentation is over my article describing radiofrequency coblation technique for arthroscopic meniscectomy of the knee. Amber Carroll, University of Kentucky College of Medicine, and Chris Bryce, physical therapist for MedCenter Health, are co-authors with me in this study. My only disclosure is Smith & Nephew, with whom I provide consulting or advisory services, as well as speaking and lecture duties that have financial incentive, such as fees or travel reimbursement. My co-authors have no financial incentives to disclose. Here's an example of me using RF coblation for the treatment of a wave lesion. The red flashes at the probe tip end you see here are the plasma field that ablates the target tissue. Some relevant observations to note are the probe tip during application is approximately 1 to 3 millimeters of separation, the plasma field turning on and off, as well as frequently moving the tip back and forth called a brush pattern. All of these are factors that the most updated literature suggests mitigate the risk of energy overexposure to viable tissue. Once the target area has, in my estimation, a satisfactory level of annealing, observed here by a relatively increased darkened yellowish glow, the intervention is considered complete. One's understanding of the literature will bias them one way or the other. For some, like myself, the outcome studies of Spahn et al. 2010 and 2016, amongst others at the cellular level such as Allen et al. 2006, bias me towards endorsing this procedure and have seen consistent anecdotal success. However, there are still a significant percentage of surgeons who bias away from its use in light of their understanding of the most updated evidence, people that I respect, and who also have consistent success in their practice. More studies are needed that can effectively capture the risks versus benefits of shaving versus RF. Regardless of one's interpretation of the evidence, it seems more clear that one's application style plays a significant factor in reducing risk of overexposure. Thank you for watching my presentation.